we are going to show you how to do a dressing change and how to prevent infection. I'm Sean. I'm going to be the student nurse.
I'm Chani, the patient.
I'm Michelle, the narrator.
And I'm Christine, the camera person.
And these are some of the ways you can prevent infection: to always wash your hands, wear gloves, keep the wound clean and dry, assess the patient's level of pain prior to the change dressings as ordered by the physician, take a prophylactic antibiotic, careful patient placement, and maintain a clean environment.
Hi, Miss Aruba. I'm Sean. I'm going to be your student nurse today. I'm going to go ahead and wash my hands.
Okay.
All right, can I check your ID bracelet, please?
Sure.
All right, thank you. Now, is it okay if I do your dressing change?
Yeah.
All right. Now, I saw that you were ordered a pain, something for your pain about 30 minutes ago, and you were given that, right?
Yes.
All right. So, on a rate of 1 to 10, about where's your pain?
It's about 3.
All right. So, do you mind if I pull down?
No.
Okay. I'm going to go ahead and get my gloves on.
Okay.
Well, before I get my gloves on, I first want to make sure that I have everything that I need to do the dressing change. So I'm going to have my 4x4 gauzes, I have my APD pad, I have my sterile water, biohazard bag, gloves, and tape. So the first thing that I'm going to do before I even touch the patient, I'm going to get these ready and I'm going to open them. You can open them as long as they stay in the packaging. And another thing that you can do with the sterile water is actually pour it onto the bandage in here. So I'm going to move this over here. Okay.
Looks like a lot of bandages.
Well, 2 of them are going to be for cleaning.
Oh,
now, when you have the sterile water, which will help to clean the wound, you want to pour a little bit first into the garbage, and that is to make the side sterile. So I'm going to go ahead and pour a little bit on there. I'll lift this up and pour a little bit in there. Now the other one I'm going to keep dry because that is what we're going to use for your dressing.
Okay.
So I'm going to go ahead and pull this down. Is that okay? So I'm going to pull this down and pull this up. And what we want to do is remove the tape. And it's always a good idea to be very gentle, to not pull the skin, because we want to keep the skin's integrity. Okay? So I'm going to go ahead and lift these tapes up. Now, Michelle, what are we looking for here?
When assessing an incision site, you're going to look at the color of the incision, assess the patient's vital signs, check to see if the incision site is hot to the touch, look for swelling, foul odor, pus or purulent drainage, check to see that the wound is well approximated.
I need to stop you for 1 second. Now, something that is very important that I did not do is I did not get my biohazard bag out and ready. So at this time, I'm going to reach over and grab my biohazard bag and put this in there. And this is a big step to make sure that you always do. All right, sorry about that. Okay. Is that all of them?
Mm-hmm.
Sorry. All right, so we have this wet. So we want to take this. Oh, and we have one that's still there. So we're looking at her wound, and we want to make sure that we clean any blood that is dry on the wound. We want to look for the infections, make sure that there isn't any inflammation. So I'm just going to dab this top part.
How's it looking?
It looks really good. I'm going to take this one and go along, go down the middle. Go along the side. Go along the other side. Grab the clean dressing and just put it on the top. Your APD. Lay it on top. dispose of your gloves. Get your tape. Does that feel okay?
Yeah.
All right. So I'm going to pull this down to make sure that the patient is comfortable, and then I am going to come over on this side. Is there anything else that you need to do, Miss Aruba?
No, that's all.
All right. Well, I'm going to go ahead and leave the call light right here.
Okay.
If you need anything at all, just let me know. All right? Thank you. And then I will dispose of this where my facility says is the proper way to dispose, and put these away and throw them away. Thank you, and that's how you do dressing change.